Hi there, I'm Dr. Stephen Fallon. Welcome to Dental Excellence. And for today's video, I'd like to share with you a new tip for bonding porcelain veneer restorations. And for this tip, I'm going to share a case that I inserted or bonded the porcelain restorations to, the veneers, last week. Well, mostly veneers, one jacket crown. I bonded this case in last Wednesday. Today's Monday of the following week. And I filmed some video in my Zeiss dental microscope, which I'm going to share with you a very small clip from bonding that case in, which will illustrate the point of this dental excellence video and tip today. And so the case was actually 6 upper feldspathic porcelain restorations, in addition to 4 lower feldspathic restorations on the lower incisors, and 2 zirconia crowns on the lower right posterior molars. We also equilibrated the patient. So it was a comprehensive treatment plan for this particular patient. And here's the all the restorations in one slide. And the porcelain restorations, the bonded porcelain restorations, were feldspathic based restorations built on refractory dies by Harold Heindel, the dental ceramist that I use for all of my cosmetic porcelain veneer and reconstructive type of cases. And so if you look at the patient beforehand, patient was referred to me by another dentist, a colleague of mine, who was concerned with the tooth wear. She was also concerned with the tooth wear. And the big complaint that she had was that she was having a lot of trouble finding her bite. She couldn't find her bite, and she had some issues just with muscle tension and just muscle incoordination. So when she came in for the records, she was coming from out of town, so we had booked the records appointment as the initial appointment, so the functional analysis as the initial appointment. And when she came in, I realized I can't even take a CR bite record for this patient. It was just too difficult. Her muscle incoordination was too pronounced. So we proceeded to deprogram her. I used a Coys deprogrammer in this case, which is an excellent appliance designed and developed by Dr. John Coys. I had this fabricated. At a second appointment, I inserted this appliance. I still did not try to take the bite records because I wanted to deprogram her for 10 to 14 days. She came back about 14 days later, and her muscle issues and incoordination were improved in a big way, improved vastly. So we took the records that we needed at that appointment. The third appointment that I did see her, we took the CR bite records, we mounted the case, we did all of the planning for the case, and then I had her back for a treatment planning consultation where we developed the treatment plan that we ultimately went forward with. We then used the models, the mounted models that from the patient post deprogramming to create the diagnostic wax up. So here's the diagnostic wax up, which, as you know if you've been following me, we use to create the guides, the preparation guides, plus the indexes to create the provisional restorations, which then we test and then use those as a guide to make the final restorations. So all of this was done using my usual systems that I follow in my dental practice, the different foundational pillars that I use to create these cases. So this was all done the usual way, really. And then last week I took this picture when I removed the provisional restorations, just to show how well, following all these systems and these foundational pillars will make your life easier when you bond the case in. So this was the tissue health after removing the provisional restorations, which were based upon the diagnostic wax up and the blueprint for the case. So tissue health looked good here. We proceeded to bond in the restorations. In this case, I bonded the 6 restorations in at once. I wouldn't recommend this if you're new to bonding in porcelain veneers, because it is difficult to bond 6 in at once and have everything lined up perfectly. The tip I share with you today will help you But if you're a novice at this, do not try and bond in 6 veneers at once. You're much better off bonding them in pairs, in which case I would bond the centrals first, the 2 centrals first, bond them in 2 units at a time. So centrals first, and then lateral cuspid second, and then the other side's lateral cuspid third. That would be the pairings of the veneers that I would bond in pairs. You could also bond them in singles as single units, and there's nothing wrong with that, but I'm pretty comfortable bonding them in with pairs. And in some cases like this one, I actually bonded all 6 in at once, and it provides a nice video to show how we ensure seating as we're bonding the restorations into place. So now I'd like to share with you the try-in. This is the try-in of the actual porcelain veneers created by Harold Heindel. And then I filmed all of this with my microscope. This is my Zeiss ProErgo microscope, and I've recently bought a 4K camera for this. I'm not uploading the video that you're about to see in 4K. I will be doing some 4K video down the road, and I did record the source video for this in 4K, but I'm going to upload it in 1080p just to make life easier for the workflow for this particular video, because I can't record this one in 4K, just the way that my workflow is set up. So what I'm going to share with you now is the actual tacking of the restorations, because I'm using a light cure only system, so I don't light cure the cement, or I don't dual cure the veneer cement. These are veneer type of restorations except for one of them. So I want to control everything and make sure everything's perfectly seated before I light cure the restorations. It's light cured only restorative material. It's actually 3M's veneer luting cement, and it's a nice kit. But the key here is I am going to ensure full perfect seating of the restorations, and then I'm going to tack them. And the tip that I have for you today is just showing you how I use this small 3mm light guide on my curing light to tack the restorations and ensure that everything's perfectly positioned and tacked in place, and then I could continue to remove the excess cement and then tack them further. And that's the tip. You know, you could really get precision fitting of your restorations and seating, and you have plenty of time to remove the excess cement so that you get a final restoration that's bonded perfectly into place, but you don't have excess resin cement everywhere to clean up. And the light curing unit that I use is the 3M SB Elipar, yep, S10 light. But here's the key is I'm using this 3mm light guide. So you'll see this in the video. Now the video is through a filter in my microscope. So I have a filter on my microscope filtering the light so that we don't prematurely set the veneers. It would be pretty bad to film this and prematurely set the veneers in the wrong location. So all the light you're seeing is with the filtered light from the microscope, so we don't prematurely cure the veneers. So everything looks kind of yellow, but that's totally acceptable, I think. And then we also use a shield just to be on the safe side. And we're using a shield as well so that I'm not looking at the light when we're curing this, the blue light from the from this light. So I don't want to look at that bright light as I'm looking through the microscope, and my assistant is tacking this down. The other cool thing with this light is we can tack for 1 second. So if I hold this, we can get a 1 second cure just by holding it down. And that's, I think, really advantageous. Small diameter, 1 second cure, gets my veneers tacked into place, then I can remove the excess cement, and I have an easier finishing of the restorations. So let's see the video now. So again, this is orange because of the filter on the microscope light. So here we are, and you can see the way that I hold these down and ensure that they're seated properly is I'm holding with Explorer. Usually I'll use an Explorer or some kind of instrument, and then my fingers. So I'm holding with my finger or my thumb, and then the Explorer on the facial to make sure I don't tip them, because veneers could tip if I hold them incisally only. My assistant's coming in with this light. You can see I'm checking my seating. I'm holding it down. My assistant comes in with the light. I help guide her, and she tacks for 1 second. So you can see I'm just redirecting the microscope now. I've tacked the 2 centrals. The next thing I want to do is tack the rest of the laterals and cuspids. But before I do that, I make another effort to make sure everything is perfectly seated. So I'm going to spend just a couple minutes, not even minutes, but a couple seconds, just checking that everything is perfectly seated. Because once the centrals are tacked, something could move on the laterals or cuspids, and then I don't want to tack that in the wrong place. So you can see here I'm holding it again. We're going to tack it for 1 second. And then do the same with the cuspids. With the cuspids, if it's the last veneer in the series, I'll angle it a little more distally, so I don't tack the resin cement between the cuspid and lateral. Again, the lateral I'd go right in the center, the centrals I'd go in the center, the cuspids, if there's no bicuspid veneer, I would go slightly distally. And I wouldn't recommend bonding in more than 2 at a time, or 6 at the time at the max. I'd never try 8. I find it's too many. So here I'm again holding it. I'm holding it. Assistant comes in holding the light guide, the light curing unit. And then when I tell her to, she tacks it. And you can see we've tacked those the lateral and cuspid and central on this side, and I haven't cured the material interproximally or at the margins, because it's just a 1 second tack. And now here's another tip. You can use this instrument, this little rubber tip instrument, and remove most of the flash, the excess resin cement, before it gets cured with the rubber tip instrument. So here I'm just using the rubber tip instrument, removing any excess at the margins. And you can see there isn't a lot of excess here now. You can use the Explorer to help remove excess, and of course use the rubber tip instrument. And then I'm checking my margins. Most of my margins are equal to super gingival, so that helps as well with the cleanup and the seating of the restorations. And again, I'm just checking with the Explorer. Be really careful with the Explorer not to nick the tissue and cause it to start bleeding. With magnification, it's easier to be careful. But the rubber tip's really gentle with the tissue. You generally would have to try hard to ding the tissue with the rubber tip. Here I'm just finalizing and making sure everything's in the perfect location. And now I just do a 1 second tack on the cervical margin, right in the middle of the veneer. And I do this to get those veneers locked in place in 2 locations, and then I could floss interproximally and make sure I remove the majority of the remaining excess resin cement before we do a final cure. And then with the final cure, we use the bigger light guide, the, 8 to 10 millimeter light guide. But with the tacking, I would tack it 2 to 3 times per veneer, floss it nicely, and then use the larger light guide. And we thoroughly cure our restorations, but we would do it in an alternating manner so we don't overheat anything. So I would leave the room once I've removed all the excess cement, tacked them on, flossed interproximally. I then leave the room and my assistant light cures with the bigger light guide. She does an initial curing, then she glycerins all the margins and does a final completion curing. So we do like to make sure we're curing thoroughly. So then if you want to see the picture, there's the 3M light, Elipar S10. And then here's the little light guide. It's just the Elipar S10 3mm light guide. And that's what you're seeing here in my hand. And then the rubber tip. I get asked once in a while where this is from. The best one that I've found is this Sunstar gum rubber tip. It has the softest tip. Some of them become too stiff and you can damage the tissue, or they don't kind of bend around the veneer margin, the outside of the root and the veneer margin nicely. So this one's fairly soft and gentle with the tissue and tends to kind of bend as I'm as I'm rolling it along the margin to remove the excess, as you saw in the video. This company used to be called Butler, but I believe now it's called Sunstar, and it used to be Butler gum, now it's Sunstar gum, but that is the product, or the particular product or instrument that I use. And then if you look at the case, here's the case immediately post bonding. I took some photographs, and you can see the margins look really good. We've got no real excess flash. I can show you in another dental excellence video what I use to remove excess flash at this point. And I have a great tip for that. I'll use that in a future video. I have it videotaped as well. In this series, I could easily pull that video and share that with you as well. Because at this point, if you have some extra flash around the veneers, you don't want to damage the porcelain. So I'm really particular about what I use in this stage of the restorations also. And then you can look close up at the margins. If you look really close up, you know, we've got beautifully fitting margins post bonding, and we're not having overhangs of resin cement or porcelain or anything like that. And this will lead to great tissue results. In fact, I saw the patient today for a follow-up, so that would be a 5-day follow-up. And you can see there's the before picture of the veneers and then the after, and the tissue's starting to look great already. So it's already improving, and will fill in over the course of the next few months. And if you look at the before, you know, we facially generated the incisal edge position for this patient. She had had a lot of chipping on her previous veneers because she had worn her cuspids so excessively. So we've rebuilt the cuspids to rebuild the guidance, and we've facially generated the incisal edge position based on her aesthetic preferences and phonetics and occlusion. And so if you enjoyed this little video and you enjoy my dental excellence videos, I have a new free training for you. Next week, I'm going to host a brand new training webinar, the 6 pillars for treating the complex wear patient. And so it's going to share with you what I think are my 6 foundational steps, 6 foundational concepts that I follow when I'm treating wear patients, whether it be full mouth cases or a veneer case like you've seen tonight. And this webinar will be hosted Thursday, May 26th at 8 p.m. What we've done is there'll be a place below this video, a little link to join and register for this new webinar. If you're watching this on my blog, there might even be a pop-up box that comes up while you're watching this video that'll show you the information to register for the webinar. What I'm planning for this is I want to get the information out to as many people as possible. So I'm going to present the webinar on Thursday, and then I'm going to present a couple of encore presentations of the webinar for alternative times starting on the Saturday, the 28th, I guess it would be, using an alternative platform, a different platform than I've usually used, and some different software. So we're going to figure it out on next Friday, the 27th, and we'll make it available for you to watch an encore presentation. So even if you can't attend next Thursday at 8 p.m. Toronto time, that's Eastern Daylight Time, Toronto time, if you can't attend then, register anyway, and those of you that didn't make the live webinar, we're going to send you an invitation to watch the encore webinar with a few different alternative times. We're testing this out. I'm going to see if I like doing it this way, and we'll go from there. So the case I'm going to present, one of my favorite cases the last couple of years. It's a nice veneer, implant, and reconstructive type of case. I didn't do a full mouth rehabilitation for this patient, but I did treat his entire upper arch, plus 6 lower veneers and 2 lower implant crowns. So we had to change the occlusion significantly because he had some definite occlusal problems, and I think it's a terrific case. So I'm going to share with you this case in detail, basically being the case that I share to explain what I think are the 6 pillars for treating these cases, the foundational pillars for treating complex wear patients, which this patient was. Even though I didn't treat him with a full mouth rehabilitation, he was still a complex wear type of patient. And I just saw him a couple weeks ago. This was the 2-year post-treatment photo from 2 to 3 weeks ago, seeing the patient. And the case has held up beautifully. And he does not wear a bite splint or protective appliance of any kind. I've engineered the occlusion for force management, which might be one of the foundational pillars. So I've engineered this case for force management, knowing that he wasn't going to wear a bite splint. He wouldn't wear one, he told me. So, this is, as I said, going to be a really high content webinar, definitely training content, not just before and after pictures. And I'm going to maybe throw in some different clinical video as well to help illustrate and teach the training material. And so again, Thursday, May 26th, 8 p.m. Toronto time. If you cannot attend the live webinar, don't worry about it. Register anyway. We will send you an invitation for the encore presentation with some alternative times that should work for you wherever you are in the world. Because I believe we're going to make it 2 different times a day for the next few days after the webinar, plus an instant access version. So I'm going to have a few different versions for the encore presentation. And you'll still be able to ask questions during the encore presentation. At least if everything goes as planned, you'll be able to ask questions, and I can still answer some of your questions even during the encore presentation. So once again, thank you for joining me for this video, this dental excellence video. I hope you enjoyed the tip with the 3mm light guide. It's awesome tip for veneers. I'll tell you, I'm sure many of you are doing these kinds of things to try and control the seating of your veneers. Again, with veneers, consider only using a light cured only material, not a dual cured material, and really focus on making sure everything's seated really perfectly, because that'll make a huge difference in your cases, obviously. So once again, remember, you can do this kind of dentistry. Beautiful dentistry with precise fit and occlusion is not just for the gurus. So thank you very much, and I'll see you on May 26th or on one of the encore presentations of our new webinar. So thank you very much.